Good morning. We're here today with Harland Holman, family physician with Spectrum Health, and we're going to talk about men's health as part of November and Men's Health Awareness and our Beards for the Boys campaign to help raise awareness around men's health. And so Harland has agreed to sit down and chat with us a little bit about men's health and answer a few questions and share some information with us. So thanks.
Hey, great to be here.
Yeah, thank you.
Yeah, thanks for coming.
Yeah. So tell us a little bit about your background. How did you get into family medicine and men's health?
Okay. Well, I kind of first decided to go into primary care out of medical school. I kind of wanted to take care of the whole patient and their family, not just one little organ system. So then I went through Michigan State for med school, then Michigan for my residency training. There I kind of met some mentors that had a special interest in men's health and worked with some urologists there. And then I went to a private practice that was in Kentucky. And when I kind of tell the story a lot, but when I was in Kentucky, I went to a practice that primarily had all female physicians, and I helped out there from time to time. And when I went there, a lot of the staff and patients there, kind of the word got out, there's a male physician. And I realized then that a barrier, and it is for me too, I think, one, guys don't like to come in and see their doctor anyways, but they particularly don't like to talk to their doctor about certain issues, and sexual health was one of them. So kind of men came up and lined up and asked me for Viagra or some other medicine to kind of help erectile dysfunction. But I realized then, and I've seen throughout my 10 years now as a family doctor, that it seems like guys faint more often when they get blood work done. Their blood pressure is more elevated at first when the doctor walks in the room. So, and once again, I think that happens to me too. So I feel like I can relate to men and their health issues. When I switched over to Spectrum too, originally our office all had female doctors too. So I think I kind of more men kind of sought me out too to be their family doctor. So I guess that's kind of a little bit of background.
So what are some of the most common health issues that men are dealing with now, and why do you think that is?
So the number one reason why men probably die younger than women is cardiovascular disease, and I think there's several reasons. They probably have a harder lifestyle. Their blood pressure is usually more elevated. Cholesterol is more elevated, and testosterone is kind of an interesting hormone that I've been doing some research on, but that probably plays a role too.
Yeah, we hear a lot, and we've all seen the ads for low T and all that kind of stuff. Tell us a little bit about that.
Yeah, so really that low T diagnosis came on when the pharmaceutical companies started making testosterone and making a lot of money off of it.
Right?
So the sales of testosterone really over the last 10 years have gone through the roof, but it's not like there's a new epidemic of it. Maybe that, and I do believe if a man has low levels several times, less than 300 is kind of a cutoff, they may be in that lower spectrum. But I've had a lot of patients that have had lower levels that if they do some lifestyle changes, they can get it up without needing any medicine. Some of the symptoms are low sex drive, fatigue, so they're kind of vague symptoms. We don't routinely screen people unless they have those symptoms, but in the right person, if their levels indicate that they're really low, I think it can make some of the difference, but it's got to be monitored, and there's risks with it.
Sure. So what's the main diagnose or symptom?
I guess the two main ones I see are fatigue. So I had a patient that the psychiatrist was trying to treat him for depression. Tried different antidepressants and wasn't getting anywhere, and so the psychiatrist said maybe it's your testosterone. Checked it and was low, and they sent him to me to evaluate. So so kind of the fatigue, no energy, and then the low sex drive is the other symptom that we see.
And so why do you think men have more heart problems or cardiovascular issues?
Well, so the risk factors are there, and I think part of the problem is, and hopefully this campaign is going to touch at, is getting guys in earlier, because I think, you know, if you treat blood pressure earlier, if you treat high cholesterol earlier, it doesn't end up causing heart disease. So screening for those things, I think the good evidence shows that guys often come in at a later stage in all of those diseases. So,
how can you, what are the lifestyle things that guys can do to kind of reduce that risk?
okay, you know, really a lot of it comes back to diet and exercise. And for diet, there's really good evidence that the Mediterranean diet's probably the best diet to do to decrease your risk for heart disease. So it's fish, not a lot of red meats, whole grains, and tons of fruits and vegetables with olive oil and nuts. So it's not a bad diet. I think that the fish, some people don't enjoy as much, but it depends on how you prepare it.
Yeah, definitely.
Yeah, and then the exercise.
So they say that women are the health decision makers. What should women know about getting the men in their lives into tested and getting them to go to the doctor?
So, you know, I think the first thing they should know is if they have a significant other or family member that's over, I would say at least once before 35, but I'm a big fan of yearly checkups just so you kind of know your doctor in case something goes wrong. But definitely they should be checked before 35, and then after 35 I recommend for sure yearly. And you know, they could tell their partner, friend, family member if they're afraid to see the doctor. Let them know that we're kind of getting to the age where there is a little less paternalism. So if they do not want a rectal exam or a prostate exam, they can say no. And I think most doctors would roll with that. So they shouldn't have that fear that shouldn't be a reason why they shouldn't see a doctor. Because I have seen patients where, you know, they're worried about that.
That's a big concern for me, right?
Yeah.
So yeah, talk more about that annual. I guess we don't call it. Do we still call it an annual physical? Or is it
you know,
more,
we still use that word physical too, but you know, I think more than the physical exam usually points to, you know, listening to the heart, lungs, and all that. And I think that's important. But for my patients, a lot of times the history is the biggest part. You know, what's your family history? We're finding more and more genetic causes for diseases. So what are your risk factors for things? And just kind of sitting down and seeing what symptoms might indicate something early that we can catch early. So we call it history and physical, but the history I think is a big part.
And isn't it too about just getting to know your doctor and feeling more comfortable with your doctor and that sort of thing?
I think having,
because if you only see them once every, whenever, 5 years, 10 years, there's not much of a relationship there. Right,
exactly. And I think, you know, in the future, maybe it'll be, you know, once you know your doctor, you can do a Skype visit or a visit on your phone. But I think it is important to have that relationship, because then when things start to go wrong, or, you know, you have some big symptoms, you kind of already know what your patient, what that relationship, how things are going. So,
So men are at higher risk of things like esophageal cancer, the abdominal aortic aneurysms, different symptoms of depression than women. Why do you think we see these types of differences?
You know, I think that there's some parts that are genetic. The Y chromosome carries some risk for diseases, and then some of it's lifestyle. I think a big part is lifestyle. Guys tend to self-medicate often, you know, to treat their anxiety, to treat their depression. They'll smoke and drink. And then there's been some studies kind of showing that there's a big bump in the middle ages for men, but over drinking. So I think there's genetics, there's lifestyle.
Go way after college.
Right. Well, it kind of goes down a little bit and then comes right back up. Like they have I guess, their mid-50s, they relived their college. Not in a good way.
Yeah. Well, I know you've talked in the past a little bit about abdominal aortic aneurysms. Tell us a little bit about that.
Yeah, you know, that's a newer screening recommendation that guys that have smoked at all, they don't, even if they quit 20 years ago, once they get up into the 60s,
that increases
they're supposed
your
to,
risk.
right, and they're supposed to get a screening ultrasound at least once at that age, because what happens is when you have an aneurysm, your vessel wall starts to bulge a little bit, and often there's no symptoms at all until it ruptures. Once it ruptures, there's a 50% mortality rate. So that's one of those things that if you can catch early and diagnose and get it treated, you can.
Is it fairly easy to treat?
Yeah, it is.
Diagnosed?
Yep. They can either surgery or sometimes put stents. I refer to one nice thing about Spectrum. We have a network, and sometimes it's just a matter of monitoring it before it gets to a certain level, and then treating things that can make it bigger, like high blood pressure, cholesterol, lifestyle things again that might increase it. But just detecting it. That overall, since it's been a newer recommendation, the statistics say most men aren't getting that done. So I think that's one thing in this campaign I was hoping to push is
and it's
getting the word out.
Around what age?
60.
60.
Yep.
Okay.
Yep.
And African American men are a little higher risk. Is that right?
Yeah, they are. So once again, that's just kind of a blanket statement for men. And if they have high blood pressure, if they have symptoms, you may even want to check it sooner.
Okay. What about diabetes?
Diabetes, same thing. I think the problem in men's health is that we're catching it too late. If you screen and detect it early, usually there's no symptoms, and then you can start those lifestyle changes. When you should be checked kind of depends on risk factors again. If there's a strong family history, you definitely should get it checked. If you're overweight, you should get it checked, and then usually I'll routinely check it in guys over 35.
Which you mentioned being overweight. What about BMI? Is that a really good measure?
It is. Yeah, we use that. I know there's other measures, but I think that's better than weight because it takes into account your height. So some people look at abdominal circumference, and but I think the BMI, the most studies are there. Yeah, you might be able to change that a little bit depending on how tight your pants are. But we track the BMI. Over 30 is considered overweight, and we'll talk to guys about some lifestyle changes.
Okay. Any other advice or words of wisdom for guys, or
Yeah, I think get in, talk to your doctor. If you're having any sexual issues, talk to your doctor about that because I know that could be uncomfortable. But working with a urologist here, we've found and talked about there's a high risk for heart disease if you're having any erectile dysfunction. And we wrote an article about it being the canary in the coal mine or in the khakis.
Oh, yeah.
And I do believe that's true too. So usually if you are having any erectile issues, I recommend getting an EKG to check your heart out at least, and maybe even a stress test.
And are you writing a book or a chapter?
I wrote a chapter in a men's health book, about sexual health. So maybe that's another reason why that's my passion right now. But I think the evidence says that both doctors and patients feel uncomfortable talking about. So maybe this talk will get the word out a little bit about it.
Well, thanks for talking with us this morning. And it's Beards for the Boys, hashtag BFTB. And if you'd like more information about events and how you can get involved, be sure to check out our website at beardsfortheboys.org.